So if a patient, it's been determined, either they have really bad teeth that you cannot save, they all have to be removed, or the person wearing a denture, what are their dental implant options when they go to your office?
Yeah, my office, what we do offer, but it isn't our favorite of all the options, is a denture that snaps into implants. Many times for the lower jaw, we can utilize 2 implants, and that is a lot better than a denture that just floats, that moves around. You're still going to get some movement of it because it is just 2 implants.
Snap in, snap out?
Snap in, snap out. And with that, it's still a denture, but it's going to have a lot more hold than it would before. And many times for patients, if they can qualify or they have the right bone for it, we can actually use 4 implants, which is still a snap in, snap out denture.
How come you don't like those?
The reason being is that, and having done well over 200 of them in my career, is that while they're oftentimes great to start, the challenge is that they really need constant maintenance. The connectors need to be changed out. The items that connect to the implants themselves need to be changed out. So even though they may be a little bit cheaper up front, you find in the long term they end up costing as much because of how much maintenance that they take. Patients don't like them.
It's still a denture, right?
It's still a denture. It's still a big, thick piece of plastic. For the upper, we're still going to cover the roof of the mouth with the acrylic. So they're getting a little bit better hold, but they're not actually getting the ability to have teeth that they don't have to worry about.
Good.
And that's where we really lead to our third option, which is really our favorite one and what we encourage most people to consider, is the full jaw of teeth that are connected to the implants that don't come out. They're stronger, they're much more durable. The maintenance on those is very little because they are held in very strongly with the implants.
So on the lower, how many implants to give them the full set of teeth?
Yeah, on the lower, 4 is usually our minimum of what we're looking for. Many times we're looking for 6, really for each of the jaws there, because that gives us a nice kind of broad range and spread of implants to hold them in place. But from there, 4 is the minimum, and most patients have the room for that. And
now what about the upper teeth?
Yeah, and the upper teeth, many times the same thing. 4 to 6 implants is what we want, and that allows us to make them a set of teeth that don't connect and doesn't cover the roof of the mouth. Connected to the implants, they don't come out. They're much thinner, and they're much more teeth-like feeling. It's made out of the same material we use for most of the crowns we use within dentistry, so it's very strong, it's very durable, and it's made to look much better than just a piece of plastic. They're made out of a material called zirconia, which is just very lifelike, very aesthetic. It's a type of teeth that people look at and they have to really question if they think they're your teeth or not. But for most people, they're very lifelike and they're teeth that just really are able to match their personality.
What could they eat?
They can eat everything. From there, the big thing we do ask people to avoid is eating ice, because if it can break your real teeth, it can break those teeth as well. But most people go on and are able to eat just a full, normal food: lettuce, steak, eating a good salad, eating some of those crispy croutons, which can be a challenge for people that have bad teeth.
What about like almonds, things like that?
Almonds and nuts as well.
So no restrictions once they're all healed up?
Once they're all healed up and everything is healed correctly and they have their final teeth, no restrictions. We tell them to go eat. I usually like to give my patients a gift card to a nice steakhouse so they can actually go try them out the first day they get their final teeth.
Is that right? Are they a little nervous the first time, biting into something?
I think they are. I think they all kind of wonder, is this going to end up like where they were at before? Is this really almost too good to be true? But with that, once they realize how much they can actually do with those teeth and how good they feel, they're able to live their life a new person.
An 80-year-old, 90-year-old is your oldest patient
it is, yes.
doing it. It seems painful.
You know,
that's like a lot of pain.
Yeah, and with that, the patients are sedated, they're numb. And once the procedure's done and we see them for their post-ops, most people are just taking over-the-counter ibuprofen and Tylenol. The pain is very little in most cases, and that allows them to be comfortable while they're healing.
Your dad had this done. What did he say about the pain?
Yeah, my dad had it done, and he went back to work the next day. So
really?
From there, he really had very little discomfort. From there, he was able to just utilize ibuprofen to manage that, and he was really impressed on how little pain he had afterwards.
And he did he regret not doing it earlier?
Absolutely, yeah. He wished he would have done it almost 40 years earlier. And he thought he was going to be the guy that had bad teeth for the rest of his life, that as a truck driver, that's just was going to be who he was, the broken front tooth he had since he was 12 years old. And with his makeover, we were able to give him that smile. I think he always internally thought would be great to have, and he was able to really make that step to eat the food that he wanted, to have a smile he was happy to show people, and really proud to say, hey, my son is a dentist, and he's the one who made the smile for me.